in 2026. Thanks very much for that, Arafat, for recording the session. Okay, so we're going to dive right into our session for today. For those of you who have colleagues, you have a friend, you have a family member that you know would benefit from a session like this. They've been searching for jobs. They've been looking to transition into the tech ecosystem, but it has been a struggle for them. Get them into this session today. All right. So let's dive into the main meat of what we have for today. We'll have an exciting session. Keep it engaging. You would have the opportunity to ask me questions. All right. I have my colleagues in the chat who would some of the questions that you have, but ensure you make a note of all the questions, and we'll have a Q&A just before we wrap up the session today. Okay. So we'll take about an hour for the presentation, and then we'd have a Q&A for about 30 minutes. So give or take, our session should last within the next 1 hour, 30 minutes. So what are the career opportunities available in health tech, and how do you transition into these roles? You probably have experience in healthcare already. You have a master's in public health, a master's in a healthcare related course, or you've worked as a nurse practitioner, you've worked as a nurse, you've worked as a physician, you've worked as a doctor, and you really want to get to that next level of your career, transition into something within the tech ecosystem. How do you get that done? That's the main essence of our session today. So that's one of the reasons why we are here. All right. But again, we have different categories of people in this session. First of all, we have a category of people who want to work from home. Okay, you are currently parents, you are mothers to kids, you are fathers. You want some flexibility in the way that you work. You want to be more present at home. You want a career without sacrificing your family. Okay, so that's a category of people that we have on this call today. One of the categories of people that we have. We have people who are career switchers moving from healthcare into the tech ecosystem. And for some other category, we have some of you who are burnt out. You are physically strained. You are tired of bedside care. You are exhausted. You want to get into tech, but you don't know where to start from. You don't know how to start. All right. And I'm sure a lot of you fall under this category today. And for some of us, some of you in this category, you are nurses, you are healthcare assistants, you are care workers, support workers, physicians, and so on and so forth. You want to transition. You want to move to the next level. You want to move away from bedside care into a technology driven role, but you don't know where to start from. You're scared of starting. You are scared you lose all your years of experience. All right. And of course, we have another group of people who have valuable domain knowledge. You have domain knowledge in healthcare. You are very sound. You have 5 years experience, up to a decade experience, but you don't know how to use it to transition. And you feel like when you transition, you lose all the experience you've gathered over the last 5 years, over the last decade, and so on. But that's not the case. So my mission today, what I'll be helping you achieve, 4 key things. Number one is how to convert your healthcare experience to a job in tech within the space of 6 months. How can you make that happen? All right. I'm going to walk you through that. And I would also show you how to learn the skills required to land a job in health tech. Okay, health tech itself is broad. There are multiple roles within the health tech ecosystem, but how do you learn the skills? Because how you learn determines if you get a job. And when you get that job, if you would know how to do the job on day one. Okay. And of course, I'd also show you how to gain the experience to show employers that you are the best candidate for that job. Because one of the mistakes people make is they learn theoretical knowledge, they have theoretical knowledge, but employers don't care about your knowledge theoretically. They want professionals that can do the job on day one. If they hire you on day one, you don't need to undergo any other training. You can do the job on day one. And for you to know how to do the job on day one, it means you must have done that job before you got the job. So how do you gain the experience even before you get the job? I'll show you how to do that. And finally, if you want to start today, it doesn't matter where you are. You're in the UK, you want to get a job with the NHS, you want to get a job around the healthcare data analyst role, the healthcare data reporting role. You are in the US, you want to get a job in a medical institution, in a medical insurance organization. You want to break into the healthcare ecosystem as a health tech professional, or you're in Canada thinking of PR. Healthcare is one of the surest pathways to permanent residency in Canada. I'll show you how to start today. So these are the 4 things I'll be showing you how to do. So that's the job I have. Show you there are numerous opportunities available for you, and I'll show you how to tap into those opportunities. So once again, if you have friends, you have family members, anybody you think should be here today, get them on this call. Somebody's saying my audio is low. If you can hear me loud and clear, just give me a thumbs up or type a yes into the chat so I know that you can all hear me clearly. Okay, fantastic. Thanks, Jacob. Okay, Preston, thanks a lot. Adebola, loud and clear, fantastic. Blossom. Okay, so let's get back right into the session. So who are we at Tenalytics? For those of you meeting us for the first time, who is Tenalytics, or what are we all about? Tenalytics is the leading educational technology company focused on helping people transition into high-paying jobs within the tech ecosystem. We operate out of Alberta in Canada and also London in the UK through our sister company, Amdari. So we have a presence in Alberta, Canada. We have a presence in London in the UK. And over the last 5 years, we've helped over 4,000 people with no prior experience in tech, no prior experience in data, no prior experience to land and transition into the tech ecosystem and land their very first jobs. And of course, we have over 172 full-time employees, our staff strength across multiple regions from Canada to the UK, within Africa, Ghana, Nigeria. Some of our employees are currently in the US, and we have access to over 300 plus industry experts. And you have 172 plus people that would ensure that you are able to make that jump. Some of them would serve as your mentors, some would serve as your teachers, some would serve as your coaches, your class coordinators, and you have access to industry experts that would enable you and help you transition into the tech ecosystem. Now, the focus for us is across multiple different roles, but we are here today because of health tech. But Tenalytics helps you transition into multiple roles, from business analysis to data analytics, to data engineering, data science, agile project management, cybersecurity, product design, DevOps engineering, financial analytics, and so on and so forth. Okay, so that's who we are. That's what we are all about at Tenalytics. All right. Now, for me, I'll be leading the session today. I'll be the pilot of this session. My name is Adeza Suleiman. I'm a technology expert with over a decade experience cutting across data analytics and management consulting. So you must have guessed, or just like many of you, my first degree was in industrial chemistry. I did not study anything technology, computer science. So I also transitioned from a point of zero, no experience, no knowledge, industrial chemistry in the university. My very first job out of the university was as a management consultant, but I pivoted into data analytics. And over the last decade, using Tenalytics and Amdari, I've been able to help over 4,000 people make the same jump with no prior knowledge, no prior background to transition into the tech ecosystem. All right. Currently, I work as a data analytics and engineering contractor in Canada, Alberta, Canada. I've worked as a data science consultant in the UK. I've lived in the UK. I've studied in the UK. I've worked remotely for companies in the US back when I was in Nigeria. I've worked as a data analyst with one of the largest energy conglomerates in sub-Saharan Africa. And I've also worked as a data analytics consultant with FITC, owned by the Bankers Committee and the Central Bank of Nigeria. My experience spans across multiple sectors, from energy to sports to educational technology, automobile, and so on and so forth. And I'll be sharing part of my experience as we move on today. All right, so that's just a bit of introduction about myself, who will be leading the session today, and Tenalytics, the vehicle that'll be helping you, guiding you through that journey, getting you from where you are to that job as a health tech professional. Now, this is where you get your pen, you get a paper, you get a notepad, because it's important that you take some notes, because I'll be walking you through the strategy that you need to take note of. Okay, four key strategies. And within the four key strategies, I'll build upon that and I'll show you how people have used that same strategy to transition. They were just like you. They joined a session like this. They wanted to get a job, as a health care data analyst, as a pathology data analyst, clinical data analyst, and they are there today. All right. So number one, what you have to do is you get into a high demand role within healthcare. So if you want to transition, you are a nurse today, okay? You are a support worker, you are a care worker, you are a physician, or you don't have experience in healthcare, but you have knowledge. You've gone to school, you've done a master's, you have a BSc in anatomy, you have a master's in public health, but you want to get a job within the tech ecosystem in healthcare. The first thing is to get into a high demand role. Okay. So, and it cuts across different regions. If you want to get a PR in Canada, the healthcare sector is the surest bet for you. You want to get sponsorship in the UK, the healthcare sector is the best bet. You want to get a job very fast in the US, across Europe, the healthcare sector hires the largest number of individuals. Okay. So you make it a lot easier, 10 times easier for yourself when you are already in a career path that employers are actively searching for. And that's what you have to do. All right. I'm going to walk you through some of the high demand tech roles in healthcare. Okay. So, and of course, you have the healthcare business analyst role, the healthcare informatics specialist role, healthcare data and reporting analyst, the medical data analyst, the healthcare data analyst, clinical data analyst, pathology data analyst, the clinical decision support analyst, medical imaging analyst, healthcare AI engineer. Amazing roles that are super high in demand, all within healthcare, but not bedside care, not taking care of patients, the tech ecosystem within healthcare. Now, one thing you would notice is most of these roles have something in common, a common denominator, which is what? Data. So you'd see data represented so many times. Even healthcare informatics, you work with data. The healthcare business analyst, you work with data. Okay. Now, what this simply tells you is the health, most of the health tech roles, the healthcare data analyst, the medical data analyst is a fusion of healthcare domain knowledge and data analytics. So if you have the knowledge today, you've worked in healthcare, and you combine that with data analytics, you are in a high demand role within health tech. If you don't have the experience, but you have the knowledge, or you don't even have the knowledge, you can gain the knowledge in healthcare. You combine that with data, and then you find yourself in a career path that is super high in demand. So that's the first thing you want to do. So while preparing for the session today, I just did a quick search, across the NHS, searching for data analyst roles. And of course, the NHS hires the largest number of people in the UK public sector. And it's one of the largest employers of talent in the entire country. They hire about between 1.3 to 1.5 million plus people across the UK. And just doing a quick search, data analyst within the NHS, it gave almost 3,000 positions available that are open today that you can apply to. And the salaries are also pretty much, phenomenal, fantastic salaries. You have roles like the pharmacy, clinical informatics, and data analyst. So you don't see your typical just data analyst role. No, pathology data analyst, pharmacy, clinical informatics, and data analyst. Salary between £56,000 to £63,000 per annum. You'd see roles like the medical device analyst, okay, between £37,000 to £45,000 per annum. And if you go to the US as well, the same thing. Okay, so this job was posted about 7 hours ago. So let's say roughly now, I'm going to go to the platforms and I'll show you what these jobs look like. The number of jobs available, it's phenomenal. All right. So in the US, using this platform, just one single platform, which is one of our favorite platforms at Tenalytics, for those trying to land jobs in the US, over 4,546 jobs currently available related to the healthcare data analyst role. Okay. So another position, the healthcare data analyst, data ecosystem, for example, they need professionals with just 2 years experience. And it was posted over a week ago, but guess what? Only 59 applicants. These are the type of jobs that you realize that they are struggling to get candidates to fill these roles. So when you have the skills, you have the experience, you apply to these type of jobs, you get the jobs. So one of the things we do very well at Tenalytics is to show you the best platforms to apply to. Some of these platforms are not free. They are paid platforms, but we pay to the platform so that you don't have to pay. And we scrape the jobs from these platforms and we share the jobs with you. So every Sundays, you get new jobs into your classroom. You go there, you apply to those jobs, and then you go out to other platforms and you start to apply. And if you look at the roles across the three major economies, in the UK, for example, between £36,000 to £60,000 per annum. Now, that doesn't mean that that's the cap or that's the maximum. You can always get roles that are higher than £60,000, just like this, for example. This is 63,000, but this is just giving you the average. In Canada, $66,000 to 106,000, and in the US, 80,000 US dollars to about 173,000 US dollars. So I'm going to walk you through some platforms very quickly. We'll do this in 2 minutes, okay, because of time. But where did I get all these screenshots from? Okay, so what platforms are the best platforms to utilize when applying to jobs? So I'm going to show you just, about one or two, okay, because of time. First of all, let's go to JobRite. So if I'm in the US today and I want to land a job as a healthcare data analyst, land a job in health tech, and you are not applying on JobRite, I don't know how you want to get a job. The US market currently is very competitive, but this is a platform that gives you access to numerous jobs. They scrape multiple organization websites, and the jobs you find here are not the same jobs you'd see on LinkedIn, Glassdoor, ZipRecruiter, and so on and so forth. Okay. So all I'll just do is I'll come right to to search. Let me maximize this so that you can all see my screen properly. So I'll come to search and I'm going to type healthcare data analyst. You see that pop up. It pops up here, right here. I click on that and you'd see the number of jobs available. 4,554. So I can start applying to jobs today if I want to. All right. This is a healthcare data analyst role, risk adjustment, Medicare. 79 applicants, which means I can go ahead, put in my application, and I become the 80th applicant for this particular job. All right. This was posted about 10 hours ago. Is in Boston. 70,000 per year to about 112,000. 2 years experience, analyst healthcare data, 35 applicants. You can put in your application. This was posted 17 hours ago. Absolutely phenomenal jobs available. 4,544. So the question you ask yourself is, if there are numerous jobs available like this, why can't I get a job and transition? And the requirements are pretty much straightforward. What do you need? Excel, Power BI, SQL, Tableau, Fabrics, Microsoft Fabrics, data storytelling, problem solving skills, and so on and so forth. And I'm going to walk you through that as we get there. Okay. So I can always come here, change this from the US to Canada, and I'll see numerous jobs available in Canada. And if you're looking for jobs in Canada, the best place when you want to get healthcare jobs is to look through the different provincial healthcare services. For example, I can simply search for Alberta Healthcare Services. Okay. You search for Alberta Healthcare Services.ca. Alberta Healthcare Services.ca, Ontario Healthcare Services, British Columbia, all the different provinces, and go to their careers page. The moment you go there, find jobs, search for the data analyst role or the analyst role. I'm just going to type analyst, okay? And I would search and I would see numerous jobs available. Let me maximize this again. Okay, numerous jobs available. IT analyst 2, IT analyst 2. This is in Calgary, Edmonton, Alberta, because of course it's in Alberta. These are Alberta Healthcare Services. So you'd see Calgary, you'd see Edmonton, you'd see different other cities within Alberta, and you can start applying to these jobs. Okay, like I said, one of the best things we do is to show you where you actually get these type of opportunities. And of course, if you're in the UK, what do you want to do? One of the first places you want to start your search from is NHS. Okay, jobs.nhs.uk. You go there, just type data analyst roles and click on search. 2,934 jobs available. And once you start checking, you'd see you have data analyst plasma, okay, data architect, data engineer, data manager, and so on and so forth. All right. So when you start to see the opportunities available, the question is, why can't I transition? What mistakes am I making? And that's what I'll be showing you what to do, how to ensure you have a strategy, deploy that strategy, and transition, just like Sharon. Sharon was like so many of you. Sharon was a healthcare assistant with the NHS, but she wanted to leave that particular role. It was physically demanding. It took a toll on her. Okay, she started falling sick, having so many physical pains, and she said she really wanted to transition. Sharon came to us in March 2025. All right, she came to us, she joined one of our programs. We helped Sharon. She learned the skills. We helped her tailor her CV to the job she wanted to get. She joined all our mentorship sessions. We prepped her for multiple interviews. And eventually, in about 3 months after she joined in March. By May 2025, she had landed a job as a business data analyst, transitioning from healthcare as a healthcare assistant to a business data analyst. And she kept her sponsorship. You have Pavel. Pavel was a teacher back in Cameroon, but he moved to the US. Now, Pavel realized very quickly that in Arizona, where he lived, the jobs he had available were predominantly healthcare related roles, but he had no healthcare experience. All he had done was, he had worked as a teacher back in Cameroon. So what did he do? He joined our program, the healthcare data analytics program. We worked with him, prepped him for his interviews. He completed his program in December 2024. We tailored his CV to the healthcare data analyst CV. He joined all the mentorship sessions, prepped for multiple interviews, and Pavel was able to build a portfolio. We helped him build a portfolio. I prepared Pavel personally. I helped him negotiate the job offer when the job offer came in, negotiate the salary and the final compensation that he got. All right. And by March 2025, Pavel moved from somebody who had no experience, no knowledge in technology, no knowledge in healthcare, and he landed a job as a healthcare data analyst in the US with the Arizona Community Physicians in Tucson, Arizona. Okay, I'm going to walk you through Pavel's profile on LinkedIn so you see the type of job he does and you start to appreciate his transition story. And of course, all these professionals recorded videos. They talked about their experience and how they were able to transition. I'll play a few of them for you before we leave here today as time permits. But again, you want to make sure you fill the attendance form, okay, so that you receive my slides at the end of the session, you get a recording, and you have access to everything I'll be sharing with you today. The links to the job boards where you can apply to jobs and so on and so forth. All right. We have Ikmat. Ikmat was a stay-at-home mom because she stayed back to take care of her kid. She had just given birth. So she was out of the job, the job space for quite a while, over 2 years or thereabouts. She moved to the UK for a master's in public health. But while she was doing her master's, she made a decision because every time she searched for jobs, she realized that the type of jobs and the requirements that she saw wanted her to have skills like Excel, wanted skills in SQL, skills in Power BI, and so on and so forth. But she wasn't learning that in the university. Okay, so she made a decision that, oh, if I continue like this, I'm going to struggle to land a job when I'm done with my master's. So one of the biggest advantage for ICMAT, which is a mistake a lot of people make, if you are doing your master's today, you want to wait until you are done before you start upskilling. That's a big mistake. All right. The university ecosystem usually would not equip you with the practical skills to deploy in the real world of work. It is a lot, very much theoretical. You work on theses, you work on group projects, and so on and so forth. So ICMAT saw that early. So while she was doing her master's, she wanted more. She joined our program. We prepped her for interviews. We equipped her with the skills. She worked on projects. She built a portfolio. She also wanted sponsorship in the UK. And January 2024, ICMAT was able to land a job. We prepped her for the interview, multiple stages of interviews. And I'm probably going to play ICMA's video so you listen to what she said. One of the things she said that was very profound was when she got into the interview, because of the way she had prepped, it was as if the coach that prepped her for that interview saw into the future and knew all the questions that were going to be asked. So when she got the question, she was just answering them confidently, and she got a job as an information analyst with the NHS, and it came with full visa sponsorship. You have Evelyn, who was a nurse, over 15 years experience. Today, Evelyn is a data engineer. You have Dr. Arome, over a decade experience as a medical doctor. He transitioned into data analytics. You have Tony, who was a pharmacist back in Nigeria. Today, Tony is a pharmacy data analyst in the UK with the NHS, also on full visa sponsorship. All right. So what I'm going to do is I'm going to walk you through some of the profiles of these professionals, and I'll highlight a couple of things that they did, strategies they deployed that enabled them get these jobs. Okay, so let's go to LinkedIn very quickly. And Pavel. So let's start with Pavel. Pavel, the Cameroonian, who today is a healthcare data reporting analyst with Arizona Community Physicians. One of the things you'd see is you both worked at Tenalytics. Now, this is very important, all right, because this is positioning. So if you scroll down to Pavel's profile, you'd see his role with the Arizona Community Physicians as a healthcare data and reporting analyst. He started his job March last year, 2025. All right. Prior to that, what did he do? Data analyst with Tenalytics. Now, the reason why he had this here is because when you join us as somebody who gets to solve problems for organizations. You don't join as a student. You don't join as a trainee. You don't position yourself as somebody who is learning. You position yourself as somebody who is doing the job. Because the projects you'd work on are projects that are derived from the real world. We get data from the NHS. We get data from the health institutes in the US, from the FDA. We get data from the different healthcare services across Canada. And these are the type of data sets you get to work on as case studies. And that's how you learn. So you are solving real problems that exist in the real world. The difference is the data has been changed in a way that you cannot trace any part of that data to an individual for data privacy. So this is Pavel. Today, he's a healthcare data and reporting analyst. You have ICMAT. I talked about ICMAT as well. ICMAT in the UK. ICMAT also, you both worked at Tenalytics. And if you scroll down to ICMAT's profile, she's currently an information analyst with the NHS. I'm going to play ICMAT's video for you so you get to listen to her and you hear how she was able to transition, the things she had to do that were instructive in ensuring that she was able to make this jump. Now, what we also do is we bring people like Ikmat, people like Pavel back into the program, and they come to help you. They answer questions, they serve as your body mentors, and so on and so forth. We have over 100 alumni working in the NHS, working as data analysts, working as information analysts, pathology data analysts, data architects, business architects, and so on and so forth. These are the stories of these amazing professionals. And like I said, I'm going to play a couple of videos as we move on. Now, so one of the most important things we've talked about so far is get into a career path that is high in demand. That was what Toyin did from a pharmacist. She's currently a pharmacy data analyst. That was exactly what Ikmat did. She had a master's in public health. She added data analytics to that. Today, she's an information analyst. You have Pavel. Pavel worked as a teacher, had education background. What did he do? He learned what it takes to analyze healthcare data, work on healthcare projects using tools like Excel, Power BI, data analytic tools. And today, he's a healthcare data analyst with the Arizona Community Physicians in the US. So one of the things these professionals did, and we helped them do, was position them as in a high career path, a career path that is high in demand. Because when you do that, you get positioned in a career path that employers are recruiting for today. So that's the first strategy. All right. Now, once you've identified, okay, I want to get into the health tech ecosystem. What's the next step? Step number 2 is learning the skills required to land a job as a healthcare data analyst, as a medical data analyst. How do you learn the skill? How you learn the skill determines if you get a job. And a lot of people learn the wrong way. Trust me, I've spoken over the last 5 years. I've spoken to thousands and thousands of people, and I see people making the same mistake over and over again. And I always love to tell, professionals that I come across, and I tell them something. How you learn determines if you get a job. I also transitioned, so I made all the mistakes you made. I did YouTube, watched YouTubes. I had multiple hundreds of courses on Udemy, hundreds of courses on Coursera. I never finished, but they were never helpful because when I got into interviews, Coursera was not there to prep me for those interviews. Udemy was not there to prep me for interviews. Sometimes I make a mistake and I'm stuck and there is nobody to help me out. So I realized very quickly that I was learning the wrong way. Myself and the co-founder, Ifemena, we learned together and it was a struggle because we didn't have the right methodology to learn. But after we transitioned, we realized it didn't have to be that difficult. It's actually very straightforward if you learn in a particular way. So I'll show you the best way to learn. And the same way Ikmat, Pavel, Sharon, Tony were able to learn that enabled them transition, and thousands of other professionals. All right. But before we dive into that, we need to know what the healthcare data analyst does in an organization, because it's a question people always ask. Okay, if I transition into health tech today, what would I be doing in a hospital if I'm not helping patients? I'm not doing bedside care anymore. I'm not a physician. I'm not a nurse practitioner. What do I do? So we're going to use this case study. It's an interesting one, and I want you to get engaged. For those of you that have joined my session before and you know the answers to this, please, you can contribute, but allow other people to also partake in this. Okay. So let's look at the case study very quickly. What does a healthcare data analyst do? Now let's look at this hospital, a mid-sized hospital facing ICU congestion, bed shortages, and rising inpatient costs. So to improve the bed utilization, the patient flow, cost efficiency, and the quality of care, the hospital leadership wants to know how the length of stay vary by medical condition, by departments, and by bed type. So the leadership simply wants to know, how does the length of stay, how long a patient stays in the hospital, how does it differ by the medical condition? Does somebody with cancer stay longer than somebody with arthritis? Does somebody with a headache stay longer than somebody with a high blood pressure? They want to know. They also want to know how the length of stay vary by department. So does the pediatric department have a different length of stay compared to orthopedics? Does oncology have a different length of stay compared to gynecology? They want to know. And they also want to know the different bed types, where the patients get to stay, the ICU, the general ward, the private ward, which one has the longest length of stay. Okay, so we're going to answer three key questions. Which medical condition has the longest length of stay? Which department has the longest length of stay? And what type of beds have the longest length of stay? These are the three questions we'd answer. Now, in a hospital, as a healthcare data analyst, you'll be provided with a data set that looks like this. Now, this data set, was gotten from the electronic medical records, the hospital information systems, and you get the data set and you use this data to answer those questions. So I'm going to ask you the question right now. And question number one is, which medical condition has the longest length of stay? So here you have the medical condition, row F, and here you have the length of stay, colon E. I beg your pardon, colon F and colon E. So type into the chat. Feel free to, get it wrong. Which medical condition? Okay. Somebody says stroke. Natigna says stroke. Blossom says cancer. Let's get more feedback. Ekene says heart attack. Obi says stroke and heart disease. Celine says heart attack. Carlene, I beg your pardon, says heart attack. Rose says heart disease. Yusuf says cancer. Kamar says cancer. Atinuke says stroke. So we are getting different answers. And it feels like everybody has different opinions about this. Okay, which is fine. All right, perfectly fine. So that's question number one. Now we're going to go to the second question. If you didn't participate in the first one, please try to participate in the second question, okay? Now, question number two, which department has the longest length of stay? Here you have the department, and here you have the length of stay. So which department has the longest length of stay? Type into the chart. Let's see. Yusuf says oncology. Adelaide says Adelaide. I beg your pardon. Adelaide says cardiology. Brenda, orthopedics. Celestina, oncology. Zini says oncology. Samira says orthopedic. Okay. Emmanuel says emergency. Cardiology. Atinuke says oncology. All right. Neurology from Willius. So we have different answers. Okay. Again, it seems like we all have our own opinion. Let's go to question number three very quickly. Okay. So question number three, what bed type or what type of beds have the longest length of stay? So here you have the hospital beds and here you have the length of stay. So what type of beds have the longest length of stay? Type into the charts. ICU from Samsung, General from Atinuke, Roxanne says General, Esther says ICU, Ijoma says ICU, Hussein says ICU, Carlene says General, Rach says semi-private. Again, different answers. Now, this is where the healthcare data analyst shines. The healthcare data analyst will take this data from the hospital information system or from the electronic medical records, get the data sets, analyze the data using Excel, Power BI, SQL, Tableau, come up with a dashboard that looks like this. They analyzed the data that looked confusing to us, and we had different opinions, and they come up with a dashboard that looks like this. Now, I'm going to ask the same question again, and let's see the response this time around. So question number one again, looking at the first chart right here. Which medical condition has the longest length of stay? Type into the chart. tumor, tumor. Samira says tumor. Toby says Kamar, tumor. Stella, tumor. Obi, tumor. Okay, Adebayo, tumor. Yusuf, tumor. Interesting. Now everybody's answer is the same. So we don't now have an opinion. We are answering the question from a data-driven point of view. The data has been analyzed and visualized, and now we can see the right answer just by looking at this dashboard. That's what the healthcare data analyst does. They take data that is raw and dirty and so on, and they analyze the data to make it easy for us to get information so we can take a decision. All right, fantastic. You're all correct. It's two more. Let's go to question number 2. Okay, which department? So look at this chart right here. Which department has the longest length of stay? Type into the chart. Oncology. Harriet is oncology. Joyce is oncology. Yasmin, Steve, Zini, Kamar, Frank, Sim, Chidima, Michael, Esther, Raj, Jason. Oncology. You're all correct. Now our answers are not different anymore. It's a uniform answer because we can see the data clearly. The insights, the information from the data has been extracted and visualized using Microsoft Excel. I built this using Excel. These are the type of dashboards you'll be building as a healthcare data analyst. Okay, last question. What type of beds have the longest length of stay? So look at this chart right here, chart number 3. What type of beds? Private room, Samira, Rose, Yusuf, Elizabeth, private room, Amina, private room, Lawrence, private room, Kamar, Nora. Absolutely. Private room has the longest length of stay. So when the healthcare data analyst takes the data sets, analyzes the data using different tools, they make it easy for us to take a decision looking at the insights that has been extracted. The healthcare data analyst would also give a summary of what this dashboard, really communicates, and also give a recommendation saying that because the oncology department has the longest length of stay, far more than the other departments, the healthcare data analyst is recommending that the hospital could explore optimizing the oncology department's processes to reduce the length of stay, potentially freeing up resources for other patients. And of course, investing efficient treating protocols for conditions like cancer might also contribute to shorter stays. So as a healthcare data analyst, you are no longer working, treating patients or bedside care. You are now working in front of your computer. You are getting that medical data, the healthcare data, analyzing the data to help the organization make better decisions to improve patient care, to reduce the time people wait during the emergency room, identify where there are issues, and recommend potential solutions. That's what the healthcare data analyst does. So they take data that looks confusing. They use tools like Excel, Power BI, and so many other tools, which I'll be sharing with you. They transform that data into a dashboard that looks like this, and you can now take a decision. So they help medical organizations, medical institutions, medical insurance organizations, government agencies, healthcare insurance companies, NGOs, public health companies. They help them answer questions like how many patients were hospitalized last month? How long are patients waiting to be treated in the emergency room? Which chemotherapy treatments have the best outcomes for breast cancer? How do they answer these questions? They get the data, analyze the data using technology tools like Excel, Power BI, SQL, Tableau, and so on. And then they give the results, and everybody can see clearly what the result says. And from there, the leadership can then take decisions based on the findings of the healthcare data analyst. So there are professionals that analyze healthcare and clinical data to support better medical decisions. They reduce costs, improve operational efficiency, and patient outcomes. And of course, you can work in different organizations. It doesn't just have to be in the NHS. There are so many medical organizations in the UK where you can work as a healthcare data analyst, so many in the US, so many health tech companies across the globe. You can work in hospitals, healthcare systems, government health agencies, health tech companies, pharmaceutical companies, and so on and so forth. All right. Now, if somebody asks, do you have an idea what the healthcare data analyst does? Can you answer that question? Would you say yes or no? Do you have an idea what they do right now? Type in yes or no into the chat. Yes or no. Okay. Yes, 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 absolutely. So now you have an idea of what you'll be doing when you get that job in health tech, when you get that job as a medical data analyst, a healthcare data analyst, and so on and so forth. But the mistake people make in equipping themselves with the skills to do this, to take this data right here and convert it into this dashboard, the mistake they make is they think they can get there by watching only videos, which is a big mistake. I've been there myself. Videos, imagine wanting to become a nurse practitioner, but all you do is to watch videos. You would never know how to do the job. Mistake number two is you don't work on real projects. So when you get into the room, you don't know the type of metrics you need to measure, the KPIs you need to track in a hospital. So when they ask you questions, you start to answer from what you've read, not what you've done. So you must do the job before you actually get the job. Okay. And I'll show you how to do that and how we help you do that. And of course, if you don't have local work experience, you are going to struggle. If you don't have experience in the UK, you want to get a job in the UK, those that have UK work experience will be prioritized. Same in the US, same in Canada, same across Europe, in Germany, in Poland, and so on and so forth. We have our alumni who work in those different regions. So you want to show that you have experience doing the job within that region. Okay. So if you've worked in North America, for example, in Canada, you can showcase that for those in the US. Okay. If you've worked in the UK, you can showcase that. And that's what Tenalytics helps you achieve. Amdari helps you achieve. You have the opportunity to list experience on your CV from Tenalytics and also from our sister company, Amdari, where you gain your work experience. And I'll walk you through that and break it down when we get there. And of course, a lot of people have generic CVs on LinkedIn. So you're using the same CV that got you a job as a healthcare assistant to get a job as a healthcare data analyst. You'll fall flat on your face when it comes to landing an interview. So you churn in 50, applications and no interviews. All right. And last but not the least, you don't have professional mentors. You don't have anybody within the healthcare space to prep you for that interview, to show you where to apply, to identify the nuances within that region that you need to take note of, to help you with your statement of purpose when applying for a job with the NHS, for example. These are the mistakes people make, and these are the mistakes we help you avoid when you're making that transition. So what skills do you need to take messy data, transform it into insights, transform it into a dashboard? Number one, you need to have the domain knowledge in healthcare. All right. So maybe you've worked in healthcare before in any capacity. You have an idea, about the healthcare sector. You know the different regulations, HIPAA, FIPA for those in Canada, the GDPR for those in the UK, and so on and so forth. You are well aware of the different regulations within healthcare, which are the same things that we're going to teach you if you don't already know this. But you need the domain knowledge. And then you add data analytics skills to that knowledge. So your data analytics skills would include problem solving, which is where it all starts from, identifying that there's even a problem, breaking the problem into multiple parts, using the prioritization matrix to prioritize what problem to solve first, using the McKinsey-Macy model to break problems into multiple parts. All right, using the CRISP-DM model to solve problems that are analytics related. So these are the different frameworks you would learn in problem solving. Do we have the data to even solve this problem or answer this question? If you ask the question, okay, what treatment has been the most effective for breast cancer over the last 5 years? Do we even have that data to answer the question? If you don't, how do we get the data? And if we have the data, what's the best tool to use to analyze that data? Is it Excel? Is it Tableau? Is it Power BI? That's all what you get from understanding problem solving and the analytics framework. Okay, then you move to Excel, Microsoft Excel, SQL, structured query language. No hospital would leave data in a flat file or leave data flying around via emails because of the different regulations protecting medical records. So the data would be in a database that has access control. And for you to access that database, you need to understand SQL, structured query language. You need to also understand Power BI, Tableau for data visualization. The chart I showed you where I asked you the questions and you could easily answer using the charts. You're going to build a lot of that using Power BI, using Tableau, and automate the process. But that particular chart was built using Excel. This one, okay, was built using Excel. You'd learn how to do the same using Excel. Coming from somebody who has no experience, you're going to learn how to do it. You'd learn data storytelling, how to tell a story from the data you've analyzed. AI for data for healthcare analytics, health tech analytics using ChatGPT, generative AI technology. You'd learn Microsoft Fabric. Okay, learning how to create pipelines where data would flow across multiple systems within the organization. These are the set of skills you need to transition into a health tech role. So take a screenshot. You can write it down, make a note of it because it's very important. And again, don't forget, if you want to receive my slide and all the materials I'll be sharing, make sure you fill the attendance form and this will be made available to you. So now that you know the skills to learn, the next question is, how do you learn the skills? What's the best way to learn? Because I can open YouTube and I start watching videos on Excel. But that's a big mistake. It's one of the biggest mistakes you would ever make if you go that route. Okay? YouTube videos are fantastic for people who already have the foundation, they have the knowledge, they are probably working in that role, and you are trying to solve a problem, and you've seen a video that has solved a similar problem, and you go on YouTube and search, watch the video, and then you solve the problem. But for somebody who is transitioning, you are moving from a non-technology role into this role. One of the worst things you can do to yourself is to start watching videos here and there. I've done it myself and it was a waste of my time. And I'll tell you, you don't want to make that type of mistake and waste all your time. All right. So what's the best way to learn? Two things you must do. Number one is learn in a project-based environment, which means you learn by doing the real work. So what does a healthcare data analyst, what do they do in a hospital? You would learn by doing that job. You would get healthcare data, medical data, and analyze that data. You'd solve problems, similar problems that the NHS has experienced. So when you want to land a job in the US, for example, they give you data sets to assess your knowledge, assess your understanding, and you have to go analyze that data. So what we do is we take that data, we create a case study out of it. So when Pavel got his job as a healthcare data reporting analyst with the Arizona Community Physicians, we took their data, we converted it into a case study, and anybody else who gets interviewed in that same sector, we show you the type of project you're likely going to be given, which you would have already worked with in class. Okay, so you learn in a project-based environment. You learn by doing the real work. And when you learn by doing the real work, what do? You showcase your work because nobody knows you. Nobody knows how good you are. So you have to show the world how good you are, the quality of the project you've completed. And that means you build a portfolio. So I'll show you what this looks like, what the class looks like, how you learn by doing the job before you get the job, and how you build a portfolio to show to the world that this is how good I am. You blow your own trumpet, show people before you even get into that interview, they have seen the quality of the work you've done and they're convinced that you are the right candidate. And all you have to do is go into the room, prove to them, we prep you for that interview, you smash it, and you land that job. Okay. So let's say Victoria wants to get a job with the NHS as a healthcare data analyst. What would Victoria do? She must learn by working as a data analyst in healthcare, and she must have evidence. And I'll show you what this looks like. So I'm going to take you to a live classroom. Okay, I'm going to take you to a classroom and I'll show you exactly how this plays out. So now you want to get a job with the Arizona Community Physicians in the US. You want to get a job with the Alberta Healthcare Services, the Ontario Healthcare Services in Canada. You must work on healthcare projects. Okay. So while you are learning Excel, you're not learning Excel by working on any type of project. You'd work on a healthcare related project. For example, this is a classroom, okay, where they learned Excel. You go to your class materials and you'd see the case study. The case study is what? For a hospital called St. Luke's Hospital. St. Luke's Hospital currently is experiencing so many issues. They have operational inefficiencies simply because their data is scattered across multiple systems. So what you do as a healthcare data analyst in this capacity is getting the data from the different systems and different silos into a central location, a single source of truth, so that from that single source of truth, you can help them analyze and visualize patient trends, emergency room efficiency, help them with proper resource allocation, and so on and so forth. This is how you're going to learn Excel. You learn Excel by working on this. And at the end of the day, you build a dashboard that looks like this using Excel. When you've completed this, what happens? You take it to your portfolio and put it there. Your portfolio is your warehouse. It is your showroom where people can walk into that showroom, they can see what you've done, and they're convinced that the quality of what you've done is what they want, and then they invite you for an interview. And I'll show you what a portfolio looks like. All right. So let's go to this live class that happened. So again, your live classes happens every Saturdays. And if for any reason you miss that class, there's a recording. So I can come back to the classroom anytime and I can watch the recording. I can see exactly what happened on that day. And this is the same case study. And you'd see a professional walking you through that case study. You are solving the problem together. So you can stop and say, hey, I've tried the same thing you've done. I made a mistake, or I got a different answer. Can I share my screen? You go ahead and share your screen, and then you get real time feedback. Okay, so that's the beauty of having a live instructor-led class. So the same case study, you solve this case study, you complete it in class. Once you've done that, what do? You take it to your portfolio. So I'll show you a portfolio and what that looks like very quickly. Okay. So this is the same Victoria, her portfolio, and you'd see that project she's completed, Deep Care Hospital, emergency room visit analysis. And anybody, the link to this portfolio, the URL is on Victoria's CV, is on Victoria's LinkedIn profile. The link would be on your CV, on your LinkedIn profile, so that all the things you've done, all the work you've done, everybody can see and they're convinced that you're the right person for the job. So I can come to this particular project. I can look at it. If I were the hiring manager, for example, I can see what Victoria did to help reduce patient wait time by 15%, and how she increased the patient satisfaction rating by 20%. I can go to this particular report. I can look at it, click here. It takes me to the dashboard she built using Tableau. All right. I can interact with it. Emergency room visit dashboard. I can deselect this. Everything disappears. I want to see data for Q1, only Q1. I click on Q1 and the data reappears. It is intuitive. Okay. It is dynamic. It changes based on what you click and unclick. This is exactly what the recruiter would see. This is exactly what the hiring manager would see. And there would be no doubt that Victoria has the skills to use Tableau to do the job for us. Okay. And this is what you want to have. All right. So remember, the best way to learn is to do two things. You learn in a project-based environment by solving projects like this, and you're going to work on multiple projects. By the time you are done, you'd have worked on a minimum of 10 projects. A minimum of 10 projects. So you'd work on projects in hospitals, you work on projects in pharmacies and so on, some medical organizations and so on and so forth. Multiple projects. And when you completed the project, you upload them to your portfolio. And that's where you have evidence that you've done the job. Learning by doing the work and showcasing that you've done the work. So during interviews, you'll be showing and speaking from a point of competence, a point of skills and experience by telling them what you've done, showing them what you've done, not by explaining what you can do. That's the difference between who gets the job and who doesn't get the job. Okay. So that's the second thing you must do. When you've gotten into a high demand career path, you've made the decision, I want to become a healthcare data analyst. Fantastic. Number two, what do? You must learn the skills. You know the skills to learn. I showed you. And you must learn the skills the right way. What's the right way to learn? Learn in a project-based environment by doing the job and also showcase your work. And that takes us to number three. Number three is where you gain experience. One way to gain experience is what I've shown you. You gain experience by working on projects in class. Another way to gain experience, I'm going to show you how to do that, where when you get into an interview, you can speak like somebody who has worked in that sector for at least 3 years. You can tell them what HIPAA is all about in the US, the regulation that protects patient data, the Health Insurance Portability and Accountability Act. If you are in Canada, you can tell them what FIPA means, that protects the personal health information of, people. The Personal Health Information Protection Act. If you're in the UK, you can talk about the GDPR. You are in Europe, you can talk about the GDPR and how it relates to the protection, the data protection regulation for people, patients, and so on and so forth. All right. You can talk about where and how you get data, within the hospital, the electronic health records. You can tell them you've gotten data from the electronic medical records, the hospital information system, and so on and so forth. You can speak about metrics of the things you look out for as a healthcare data analyst. You look at things like mortality rates. You look at things like bed occupancy rates, readmission rates, cost per patient, and so on. So you want to show that you have experience doing that job. And experience is gotten through the project you complete in class. I've walked you through that. Secondly, through internship. And this is where Amdari comes in. So Amdari is the sister company to Tenalytics. So when you learn the skills with Tenalytics, you must undergo internship. Internship is where you collaborate with other professionals, because as a healthcare data analyst, you are going to work with other tech professionals within the healthcare. You'd work with the data engineers who builds the data infrastructure, the data pipelines. You'd work with them. You'd work with the different stakeholders, your chief medical directors, the hospital leadership, because you need to know what they want before you go ahead to carry out your analysis. So how do you collaborate with people? How do you learn stakeholder engagement, communication skills, interpersonal skills? These are the things you do during your internship. So you learn 6 months with Tenalytics and you do 2 months internship with Amdari. And you have the unique opportunity of listing both Tenalytics and Amdari on your CV. All right. And Amdari is registered in London, in the UK, and also in Alberta, in Canada. And of course, once you've done that, what else? you build a portfolio. You must have a portfolio to showcase that this is what you've done. This is how good you are. These are the quality of the projects that you've completed. Okay. And finally, number 4, what do you do as a strategy? Don't forget, every organization will do a validation check on you. Every organization will do a background check on you before they hire you. So you want to ensure that you have a reputable organization that can say, we have worked with um, Danielle, we have worked with Michael, we have worked with Tolulokwe, we've worked with Priscilla, and they do know how to use the skills. We've worked with Lawrence, we've worked with Samira, and they have the skills to do the job. So that's one of the things we provide to you. This is an example of a reference request from the NHS, the Southeast Hospital NHS Foundation Trust. So, hello Adeza, dear Adeza, we are recruiting this candidate for a pathology data analyst role. The above candidate has, given us the permission to approach you for a reference. I would be grateful if you could let me have your opinion regarding his suitability for the post by completing the attached reference form. Okay? It is preferred that you fulfill this request by using the online form available. So you can either fill the form, there was a form attached, or I could fill the request using that link. I always do it using the link because I can do it online and it's easy to submit. So this is a reference, an actual reference for somebody who landed a job as a pathology data analyst with the NHS. So every organization would do a background check. So you can't say you are a healthcare data analyst, but you have no organization to back you up. You have no organization to write a reference that you can use Excel, you can use Tableau, you can use Power BI, and so on. You are not going to keep that job. All right. So just to recap, everything I've said so far falls within these 3 categories, this particular framework, the LEARN framework, which means you must learn the data analytics skills and you must understand and have the domain knowledge in healthcare. Okay, so you get into the right career path. Number 1, high demand. Number 2 is you know the skills. You must learn the right skills and learn it the right way by learning in a project-based environment and also showcasing your work, showing people how good you are by building a portfolio. Number 3, you must gain work experience. You must be able to show that I've worked on healthcare data while I worked with Amdari or while I worked with Analytics. You must be able to show that because that is what gives you the opportunity to reach out for a reference. Okay, so when Ikmat got this job with the NHS, guess what? They reached out to us. When Pavel got his job with the NHS, guess what? They reached out to us to provide a reference. When the gentleman, Mawutin, who got a job as a pathology data analyst, when he got the job, guess what? They reached out to us. Okay, so that's the importance of referencing. And that's the importance of showcasing that you have experience. Very important. So what we do for you is we help you learn the skills, learn the domain knowledge, and help you focus on this. You don't divide your focus. You focus on one thing, you go all in and you equip yourself. And then we package you. What does packaging mean? Packaging simply means we present and position you as the best candidate for the job. And how do we do this? You must gain experience through your internship with Amdari. We revamp your CV for you. So when you come in, after 2-3 months, we revamp your CV to an industry standard CV. And we show you how to tailor your CV to job applications and job requirements. We help you optimize your LinkedIn profile. We show you how to build a portfolio. Everybody builds a portfolio. You must have a portfolio. You join our mentorship sessions. When you have an interview, we help you prep for an interview. Okay. And I'll show you how. So You have your live classes. I'm going to break that down a little bit further. And then you have your self-paced class. So Adeza, you said live classes are on Saturdays. Yes. But what happens every other day on a Monday, Tuesday, Wednesday, Thursday? You are on your LMS, the learning management system. Okay. You're on your learning management system. So everybody would have access here. Okay. So let's take, for example, Kemisola Samira has registered. Jason has registered. Welcome back, Jason. Welcome back, Samira. Welcome back, Kemisola. Okay, I'm sorry if I murdered the pronunciation of your name. So welcome back, Kemisola, and so on. Okay, so what do? You come in here, you have an interview. You go to where you have interview preparation. And what do? You click on schedule mock interview. You fill all the details. Let me just So you have your name, you select the program, the interview stage. Is it first level, second level? You select the date of the interview. When is the interview going to hold? It's going to hold on Wednesday. What's the job, the URL to the job you've applied to? You copy and paste. And finally, you upload your CV that you used to apply to that job. And what do? We join a one-on-one session with you and we prepare you for that interview. So when you get in, you are getting in knowing exactly what to say because we've looked at the job description, we've preempted the questions you're likely going to get, and we help you prep for that. Okay. And if you go to your classroom, you have where you get to submit your CV. Okay. You upload your CV, we revamp your CV for you, and we show you how to tailor your CV. So you have two platforms, the platform for the live class and the platform for the self-paced class. This is the platform for the self-paced class. So the self-paced is where you can log in on a Monday, on a Tuesday, Wednesday, any day of the week, anytime, anywhere, and you can start watching your videos. You continue learning, you solve problems on your own. And on Saturdays, you have a live professional working with you, solving problems with you. In the UK, 10 a.m. to 1 p.m., 11 a.m. to 2 p.m. I beg your pardon. Every Saturdays, 11 a.m. to 2 p.m. in the UK. Europe, similar time zone. If you're in Nigeria, you are in Africa, 11 a.m. to 2 p.m. If you're in the US, Canada, North America, 10 a.m. to 1 p.m. Mountain Time. Okay. And I'm going to display that to show you for clarity. So you can log in any day, anytime, anywhere and watch your videos. And every Saturdays, you have your live class in, this platform. You join a live class, you have a facilitator walking you through problem solving and so on. All right. This is where you have the jobs. So where you have job offers, if you click on this link, it takes you to where you have links to different jobs that we've posted from platforms that are paid platforms, and you don't have access until you pay. But we pay to those platforms and we get those jobs and we share them to you for you to apply before you go to other platforms, the general platforms to apply. When you are learning, we know you would have questions. When you're watching your videos on a Wednesday, we know you might have questions and you don't want to wait until the next live class to ask that question. So what happens? You can book a drop-in session. So let's assume Samira or Jason is learning on a Tuesday. You can simply come in here. I have a question. I want to sit down with somebody, a professional who would help me answer all these questions. So I click here, click on the link. It's going to take me to where I can book a session Monday, Tuesday, Wednesday, Thursday, Friday, any day of the week. And somebody would join a call, look at the problem I'm facing and help me address that problem. The reason why we've done this is because we know that you are beginners. You have no knowledge. So when you come in and you're learning Excel, you're learning Power BI, you stumble on a few, blocks. You have some issues, but we ensure that there is no point during your learning journey that you will ever be stuck. You'd have all the right support to guide you through your journey, essentially. Okay. So these are the things we do to package you as the best candidate for that job. When you get that offer, we give you a reference. When you get the job and you're on a project that seems a bit more difficult than you anticipated, we work with you on the job support to ensure that you have a solid footing. We show you where to apply, how to never use one CV for multiple jobs. Okay. How to tap into the paid and the hidden job markets, and so on and so forth. So this is the framework we've deployed, combining all the four strategies from getting into a high demand career path, learning the right skills, learning the right way, gaining the work experience, having a reputable organization to provide a reference, collapsed into the learn, package, and apply framework. And this is what gets you the job. So how you learn practically: 6 months with analytics and your 2 months internship with Amdari. Again, what we've seen is people getting the job a lot faster. People getting jobs within 4 months, within 3 months. I'm going to play Ikmat's video for you. Ikmat got her first 2 offers within 3 months of joining. And the reason why she got offers and she got a job just about, I think, after 3 months was because the NHS at that time wanted somebody with Excel and SQL. These were the 2 skills they wanted, nothing more. They wanted somebody who could use Excel to analyze data and SQL to interact with the database, extract data, and so on. And within the first about 1.5 months, within the first 1.5 to 2 months, you would have completed problem solving. You would have completed Excel and SQL. So Ikmat had already gotten the skill she needed to apply to that job, even though she was still in the program at that time. So we push you to apply. As you acquire more skills, you complete a particular part of your program. Say you're meant to learn 8 different tools. You've learned problem solving, you've learned Excel, you've learned SQL. Start applying to jobs. You learn Power BI, the number of jobs you can apply to would increase. You learn Tableau, it keeps on increasing, because organization would not want you to have every single skill. There are some select set of skills that you could have and start applying to jobs. And that was what helped Ikmat. In fact, during the interview, Ikmat told them that you want just Excel and SQL. But what I'm going to do is when I come in, I'm going to transform your Excel reports to Power BI reports and automate the reports using Power BI. Because at that time, she was still learning Power BI. But the job requirement did not list Power BI. But she told them as an advantage coming to the table is I'll bring in Power BI to automate the reports and so on and so forth. And that was why Ikmat got that job. Okay, so 6 months learning, 2 months internship. For those in the UK, you are in Europe, Africa, similar time zones, 11 a.m. to 2 p.m. You have your live classes on Saturdays. And for those in the US, North America, 10 a.m. to 1 p.m. Mountain Time. Okay, and every other day, Sunday, Monday, you're on the LMS learning at your own pace, your own convenience. The mentorship sessions, we have sessions for those in the UK, Europe. This happens every Thursdays at around 10 o'clock. So I'll show you what the mentorship session looks like. The recent one we had. So you'd see your mentorship. Let me scroll. Okay, so you see your mentorship sessions. The mentorship session we had, the most recent one this past Thursday, was "You Must Get a Job." Okay, that's the title of the session. You must get a job. Job application strategies that get you interviews. All right. And if you miss this session for any reason, the recording is there. All you have to do is go to the recording, click on that, and you can watch the recording. This session was taken by the co-founder of Tenalytics, Efemena. Okay. So Efemena took the session. All right. So practical session, walking you through what you have to do to your CV, how to apply to jobs, where to apply to jobs. These are the practical sessions you get. And if you ever missed it, you can always come back, watch the recording, and see exactly how to get this done. And in this session, we introduced a tool, an AI tool called CV Matchly. You would have that on your dashboard as well. You can see that here. Use CV Matchly AI to tailor your CV. So when people say, Adeza, how do I tailor my CV? I'm a nurse. How do I tailor my CV to a healthcare data analyst CV? CV Matchly does it for you. And the beauty about CV Matchly is it is 100% automated. You just upload your CV, and it does the job for you. So you have that on your dashboard for, available to you, where you have the opportunity to utilize that. All right. So again, that was exactly what Toyin did. I'm probably going to play Toyin's video. It's a 1 minute video. Toyin, pharmacist back in Nigeria. She came to the UK. Today, Toyin is a pharmacy data analyst. All right. Pharmacy data analyst. Her very first job when she got the job with the NHS on sponsorship was as a benefits analyst. But then what did she do? She wanted to get a new job, higher pay, better pay, and she got a job as a pharmacy data analyst. That's Toyin right there. Okay. That's Toyin's role, pharmacy data analyst. Her very first role was as a benefit analyst with the NHS. So I'm going to play Toyin's video just for a minute. And then maybe the second one I'll play is ICMAT because of time. And then I'll show you exactly what you need to do today to get started. You also have Gad. Gad was a mechanical engineer. He wanted to transition into healthcare. Like I mentioned earlier, the NHS hires the largest number of talents in the UK public sector. So Gad wanted to cash in on that. He wanted to get his own job with the NHS, but not as a healthcare professional, but as a health tech professional. So he joined our program, completed his program in July 2024. He tailored his CV to a data engineering CV, applied to multiple jobs, and Gad was able to land a job as a data warehouse and ETL developer with the NHS. It also came with full visa sponsorship, less than 6 months after completing the program. You have Mawutin. Mawutin got a job as a pathology data analyst, also with the NHS on full visa sponsorship. Judith works remotely for a company in the US. Judith was a care worker. She transitioned from a carer to getting a job in tech as a business analyst with a company in the US, even though she lived in the UK. You have other amazing professionals like Abigail. Abigail used to live in Saskatchewan, Canada, but Abigail was able to transition from being a carer in Saskatchewan to working with the Alberta government as a business analyst, as a supervisor of business services and data analytics. Abigail had no experience in tech. Back in Nigeria, she worked with the FIRS as an administrative executive. She moved to Canada. She worked as a carer. She joined us, and we transformed Abigail from a carer to a supervisor, business services, and data analyst with the Alberta government. You have Esther, who was also a carer. Today, she's a contract project officer with the civil service in the UK, and so many amazing professionals. I've talked about ICMAT's story already. I'm going to play ICMAT's video. I'm going to play Toyin's video as well, and then I'll show you exactly what it takes for you to start today. If you want to start today, what does it take? I'll show you what it takes to start, and then we'll take questions before we call it a day. All right. So I'm going to walk you through Toyin. This is Toyin. Toyin is a pharmacy data analyst. How did she get this job? Let's hear from Toyin herself, and let's hear how she was able to transition. Okay. So sit back, relax, enjoy Toyin's story. Pick one or two things. Ask me questions when we get to Q&A, and I'll be very happy to answer. But let's enjoy Toyin's story.
Hello everyone, my name is Toyin, and I recently got a job as a benefits analyst in the UK. I've come from a medical background as a pharmacist who is interested in, breaking into tech. My first encounter with analytics was on LinkedIn. I joined one of their masterclass, just one masterclass where Ifemina spoke, and it just took that masterclass to convince me. I joined in August, and a month after, I got a job. To be honest with you, every information skill that I was able to apply to get that job, I owe it to Tenalytics. Tenalytics did a great job and is still doing a great job. They groom you and nurture you from the cradle till you become confident. So my advice for you, most importantly, is join. Be integrated into a platform that empowers you and allows you to easily get that first job.
That's Tony, phenomenal professional, doing amazingly well for herself as a pharmacy data analyst. All right. So I'm going to wrap up my session with Ikmat. From a stay-at-home mom, moved to the UK for a master's in public health, realizing that she wasn't going to get much from the master's because she wasn't learning the skills required to land a job in tech within healthcare. So what did she do? She learned the skills in data analytics, and today Ikmat is an information analyst. And there's something she says: she uses data for good, because she's using data to help the NHS to make better decisions, improve patient care, reduce costs, and so on, make the NHS more efficient. But let's listen to Ikmat and let's hear Ikmat's story. Okay? So let's enjoy Ikmat's story and then we'll come back to wrap up.
Hi everyone, my name is Ikmat and I was with the March cohort in Tenalytics, and joining Tenalytics has been the best decision so far. You know, for me, someone coming from a background of full housewife, because I had to stay back home to look after my child for 4 years, and then wanting to break into something new, wanting to go back into the workforce, you know, wanting to place myself in the society for better job opportunities. So it was a lot. And then I'm glad that Tenalytics came along, and then they presented me with so many opportunities right in front of me, better opportunities. And then I'm glad I took it. And then also the advice of do not sell yourself short, that Effie is always saying, it is very, very valid, because place yourself right, you know, don't sell yourself short. It's a very, very, very valid advice. You know, in Tenalytics, they will hold your hands like a child, you know, through the modules. You have the opportunity to go back and study. You have the opportunity to go back and practice. You have the opportunity to ask questions. You know, we have people you can always go back to, even outside of class hours. It's the most amazing experience so far, really. And then another thing is the interview prep, guys. That is another very important thing. I did my interview prep with Mr. Mohammed, and it is the best decision ever, because he was like, he saw into the future. He knew what was going to be asked. And I'm glad that I wrote down all the things he mentioned. I went back to practice, and then when it was time for the interview, it was like everything he was mentioning, everything he mentioned, it was just, they kept on. And then when I was answering those questions, I was so confident, you know, because I already practiced. I did an Excel test, I did a maths test, and then they were really impressed. And another thing is, guys, it may not come as fast as you expect. Definitely you are going to get some no's, and then you may begin to think you're not good enough. You are good enough, yes. The no's will come, but always take it as a basis for learning and development, because after every interview where I got a no, I always make sure I get a personal feedback. So I work on those feedbacks for my next interviews. And yes, it worked. It really worked for me, because I got my first job 3 months into the program, my first job. But I couldn't take up the job because I was a student and I was only eligible to work 20 hours. So I couldn't take up the job. 3 months later, I got 2 jobs with full visa sponsorship. And guys, all the other no's before the 2 jobs prepared me for the yeses I got. So yes, the no's will come, but do not give up, because you always have Tenalytics to go back to. They are the best and the best thing that's ever happened to me. And then yes, and they are the most affordable. The most affordable one I've come across so far, and that's a very good advantage. So yes, Tenalytics for the win.
So that's Ikmat. Okay, phenomenal lady. She had two offers. They both came with, full visa sponsorship. And she went for the offer that gave her the opportunity to work from home, where she doesn't have to go to the office every single day. It had fantastic salary as well. And we guided her all through the process. Okay, so how do you start? How do you get started? For those of you who are interested in starting your journey into health tech in 2026, one of the things you don't want to do is listen to all of these. And this is one of the things the mistake people make, the mistake you make. You listen to all of these, and at the end of the day, you don't take a decision. All right. You can't stay where you are. You have to make a change in 2026. The next cohort starts on the 7th of March, next week, Saturday. All right. So this is the last session you're going to have before the cohort starts. So for those who want to get in, I have two amazing offers for you, and I'll be sharing them with you one after the other. For those of you that have stayed all through from the beginning till the end, I have two offers for you. So for the first 20 people that will be getting into health tech, rather than paying the full amount of $1,250, you get to pay just $1,000. All right. So you have a 20% discount right off the bat. And I'm also going to walk you through how to make payments in multiple installments. All right. Because you don't have to make the whole payment at once. So I'd walk you through how to do that. And you can only get started with $200 as your first installment. Okay, so that's the first offer I have. Again, the offer is not available to everyone. It's available to the first 20 people from this session today. I had a session last week where I said the same thing. And before I left the call, before I stood up from my seat in my office, we had about 56 people who had registered. And we had to extend it a little bit anyways. That's the discount, because over 20 people within a few minutes had taken advantage. All right. Some people couldn't get, into the first 20. They couldn't get into even the first 30, and they lost out on the discount. So what I'll be advising is, if this is something you want to do, it's something that's been in your mind, you want to transition into health tech, just like Pavel did, like Ikmat did, like Gad and so many other professionals did, then this is the best time for you to start. Okay. So the second offer that I have for you is the front of the line advantage. Okay. So for those who register today and before Monday, so whichever comes first, the moment we get to first 20, this is also off the table. Or if we don't have up to 20 people that registers by Monday, this is also off the table. So in addition to everything you would get immediate access to the mentorship sessions. So which means you don't have to wait until the 7th of March for you to start before you have your first mentorship. You'd have your first mentorship this coming Thursday. You'd have immediate access, early access to the mentorship. You'd also have exclusive access to an event for those looking for alternative visa pathways. So if you have a brother, you have a friend, you know somebody who is a dependent who wants to get the technician endorsement, they want to get the global talent visa, for example, we'll be holding an exclusive event where we'll share all the strategies, the insider information of what you need to know so that you can get access to that. You can get access to the technician endorsements. And what we also do and provide, because to get the endorsement from, the technician or any other endorsing body, because technician is for tech. Okay, but you have other endorsing bodies for arts and culture and so on and so forth. We're going to expose you to all of that. And we provide you with one piece of your evidence, which is a recommendation letter. And you also get, the third part is, I think I just made a duplicate of this, but the third part is you get lifetime access to support. What does a lifetime access mean? The lifetime access means even though you are done with the program, you've gotten a job, and 2 years down the line, you want to get another job, and you need to be prepped for an interview, you have the opportunity to do that. And I'll show you an example of somebody who took advantage of that. Okay. They took advantage of something like that and they were able to have access to multiple interviews. One of them is Idris. Idris joined us a few years ago. So you're going to see that on his, LinkedIn, data engineer with Analytics. And then we helped him get his first job with Jaguar Land Rover as a data engineer in Coventry. So we prepped him for his interview. I, prepared Idris's reference and all of that. Now, about a year down the line, he came back again because he was applying for another role as a senior analytics engineer with a company in London. And we also prepped him for the interview and also provided him with a reference. So this is what you'd also get. Anytime you come to us, you have access to interviews, access to references, but it's not available to everybody here on the call. We have over 200 plus people. It's available to the first 20 people. Okay, so I'm going to show you how to get started. My colleagues would also share the link in the chat on how you can get started. So how do I start? Adeza, how do I get to make payments? Okay, so this is what you need to do. And I'll walk you through step by step. We'll come back and then take questions. All right. So one of the first things you need to do is you click on the link. Okay, just give me 1 second. So I'll walk you through step by step. Okay, so you click on this link, which my colleagues would share in the chat. All right, they share in the charts, and I'm going to show you where it's going to take you to and how you can select health tech. So you click on this link, and when you do that, it's going to take you to this point. Okay. All right, so it's going to take you to this point, and then you'd see the different programs right here. Okay, you can click on view all courses. You can click on view all courses, and it takes you to the different courses that you have. You'd see the health tech. Okay, so you click on enroll now when you get to health tech. Enroll now. At the moment you click on enroll now, you'd see the health tech program and so on and so forth. All you need to do is click on enroll. Once you click on enroll, it's going to take you to where you have the opportunity to create an account. So you have to create an account. This gives you a profile on the platform. So I'm going to create my account. Okay, and I'm going to use an email so that you'd also get to see the exact same thing when you are doing yours. Okay, so just give me a second and I'll walk you through what you need to do. Type in your email. Okay, I'm just generating a new email. Just give me 1 second and I'll walk you through exactly what you need to do. Okay, so let's copy this. So you enter your email, you enter your phone number, you read the terms and conditions, select the terms and conditions, and then you click on sign up. Okay, so the moment you click on sign up, it takes you to where you get to select when you want to start. Do you want to start this March cohort, which means you want to start immediately? You don't want to delay your start date, or you can start in April. Okay, so starting in April means you've taken advantage of the discounts. You've also taken advantage of the front of the line advantage, where you get access to the mentorship immediately, lifetime, career support access, and also you get access to our exclusive events for the Tech Nation session. All right, so you can select April or select to start in March. So let's say you want to start immediately. I don't want to waste time. I want to start now. So I select the March cohort, and then you have the opportunity to also make payments in multiple installments. So I mentioned that earlier. So I'm going to change this to USD. You can pay in multiple currencies. So you have up to 5 installments for you to pay. Now, for those of you that select 5 installments, instead of paying $1,250, you get to pay just $1,000, which means you save a total of $250. This is the most flexible choice. So you save the 20% discount. You're part of the first 20. You pay $200 every month for 5 months, and this is what gets you started. $200 gets you started. Now you have one of the most favorite, the popular options with people, which is the 2 installments. Now, for those paying in 2 installments, instead of paying $1,250, you get to pay just $900. So you would save $350, which is more savings for you, a total of 28% savings. So you make your first payment today, $450, and next month you make the second payment of $450, and you get to pay just $900 instead of $1,250. And for those that pay once, the best value, rather than paying $1,250, you get to pay just $850 because you're making a one-time payment. So you save a total of $400, which is up to 32% savings. All right. And of course, you can change the currency. If you want to pay in pounds, you want to pay in naira, you want to pay in euros, you can go ahead and do that. Okay. So let's assume I want to make payments in 2 installments. Okay. So I click on that. I want to save at least $350, or let's say I want to pay in pounds. So if I'm making 2 installments, I save £267. Okay. So I select that. I confirm all my details. And then I confirm that my information is correct. I've read the terms and conditions. Now, for your next payment date, for some people, maybe your next payment doesn't come on the 28th of March, and you want to move this forward by 1 week. You can come here, click on change dates. I want my second payments to come in on the 4th of April. You can change that on the 6th of April. If salary comes in on that particular date, you can always change the date for the next payment to make it flexible for yourself. You click on save, you'd see when the next payment comes in. You click on pay now. The moment you click on pay now, you confirm your details, your email, your phone number, and then you click on pay now. Okay. So this will take you to Stripe, and then you enter you can pay with Link as well. For those of you that have access to Link, you can pay with Link. For those that want to pay with your credit or your debit card, you can simply enter that right here. So I'll enter mine and show you. Okay, so I enter that. Okay. Enter your postcode, and then you click on pay. Okay, so the moment you click on pay and your payment is confirmed, you just have to verify your email, and you'd also be required to complete your details. So here you can see payment successful, and it's going to direct me to my dashboard. But before I get there, I have to verify my email. So I go to my inbox. Make sure you also check your spam folder just in case it goes to your spam. Okay. And if you don't find it in your spam, you don't find it in your inbox, just click on get help and contact support, and somebody would guide you on how to get this done. Maybe you enter the wrong email or something. All right. But you'd find the verification. I'm just going to check mine and see. Verify email. I'll enter the OTP 396316. Okay, verify email. Now, the moment my email is verified, it redirects me to where I have to complete my profile. Okay, so you select your country of residence, select United Kingdom, gender, select that. Okay, your preferred time. So what time do you prefer? Now, for those in the UK, like I mentioned, 11 a.m. to 2 p.m. But let's assume you are not available 11 a.m. to 2 p.m. in the morning. You can join the class for those in the US, Canada, which will be roughly 6 p.m. to 9 p.m. your time. So you can select that right here. Okay, I can see a lot of activities on the website, people making payments already. Okay, so how did you find out about Tenalytics? Select that. I saw you guys on LinkedIn. I saw you on Instagram. I saw Adeza's video somewhere. Select how you found out, you found Tenalytics. What else? Your alternative email. If you have an alternative email, you enter that right there. What made you register? I was impressed with the structure of the platform. The testimonials were phenomenal. I really want to get a job. What made you register? Enter that right there. How much time do you want to commit? We always recommend 1 hour per day at the minimum. Okay. So if you look at that, between 4 to 6 hours per week or 7 to 10 hours per week. So you select your preferred time you can commit, click on complete setup, and the moment it completes your setup, it takes you into your dashboard, the same dashboard I showed you earlier. Okay. So you'll be required to upload your photo for your LinkedIn, connect your LinkedIn so that you have, once you are, updating the things you do on the LMS, you can also update on LinkedIn as well. So this takes you to your dashboard. Even before you start, if you have an interview coming up, you can schedule a mock interview session. So let's say you register today, you have an interview tomorrow, you can book an interview session immediately. Okay. If you want to change your card details, you go to your billing history. So you'd see when the next payments would come in. Because I selected, 3rd of April, you can see that right there. You can request for a grace period. You can pay now just to, ensure you've completed your payments. You can update your card right here and so on and so forth. Okay. And this is how you get started. All right. I can see so much activity. Last week, before I stood up from here, 56 people had registered. All right. So, like I mentioned earlier, if this is what you want to do, you want to get started, then this is the best time for you to start. All right. Don't waste time. You get started, get to the front of the line, be one of the first 20 people to start. Okay. So, the question you need to ask yourself is, can I afford to wait? We're already in February. February is running away. We get into March tomorrow. And before you know it, Q1 is gone. We get into Q2. Q2 is gone. 2026 is gone. Okay. So while you are waiting, other people are moving forward, taking advantage of all the amazing offers I've shared with you. All right. We are accredited by the American Council of Training and Development. Okay. We get this question so many times. All you need to do, for those of you that have filled the attendance and you get my slide, if you click on this link, it takes you to the ACTD's website and you get to see Tenalytics and so on, our accreditation by the ACTD. We've participated, gotten into amazing accelerators with the Canada government and so many amazing stuff. That's me right there in one of the accelerators we participated in 2024, and that's Efemena and other amazing founders and co-founders of companies building amazing stuff within the tech ecosystem in North America. Again, if you click on the link you have here, you can read the articles and you see this takes you to the Alberta Catalyzer. You meet the startups in Northern Alberta doing amazing stuff. So you can read about that. That's me. That's Efemena. And, you read about Tenalytics and the amazing stuff that we are doing within the tech ecosystem. So I'm going to take a breather right here and I'm going to take questions for those of you that have questions for me. All right. Does payments include the internship? Every single thing I've shared with you, from strategy number 1 to strategy number 4 to the Learn, Package, Apply framework, everything is covered within the payment you make. There is no additional payments, no hidden fees, nothing else required from you. You have access to the platform any day, anytime, and you get to learn, and we work with you to get you to, the desired outcome at the end of the day. And for those that have questions, maybe you've registered. I can see quite a number of people have registered already. What you need to do, if you have questions for any of my colleagues, you can reach out to us on any of these emails: enquiries@tenalytics.io, admission@tenalytics.io, or you can send a WhatsApp message to any of my colleagues on any of these numbers, or you can call us on any of these numbers and one of my colleagues would respond to you. Okay. So you have access to us across all fronts. So I'm going to take questions like I promised before we wrap up today. Okay. I'll take questions from the chat first of all, and then I'll come back to those who have their hands up. Okay, so Elijah, so that we don't allow the session to be too long, as we take questions, the Q&A, maybe you want to do that as a separate recording or something, so we don't have a video that is 3 hours or a session that is 3 hours.